everybody, welcome back to my channel. Thank you for coming back. And this is your channel where we discuss everything about nursing in the UK. And today's video we are going to talk about a skill station in the Osce, that is midstream urine, and then how we do it appropriately and within the time. So let's start the video without any further delay. So as you all know, in the Osce exam, with the preparation of the Osce, whether it's assessment, planning, implementation or evaluation or any other skill, we need to follow a marking grid. So what is the marking grid? Marking grid is the guidelines for the from the examiners or NMC that we need to follow. There are steps, there are points that we need to follow in order to pass the Osce exam. So I don't make any videos without explaining the marking grid. So just to familiarize yourself, you need to familiarize yourself with the marking grid before you start preparing for a particular skill. Okay, so for this station in the midstream urine, we are going to start with the marking grid. So first station is first thing to do is the pre-procedure checks. What do we do in the pre-procedure check? We enter the room, we check for the scene safety, maintain the patient privacy, and we perform hand hygiene. This is our pre-procedure check. And that's it. So, and then the second thing you need to do is the introduction. Introduce yourself to the patient, ask the reason of their admission, and then also you need to check the patient ID at this stage, right? If it's a hospital setting, you need to check patient name, date of birth, hospital number. If it's a community setting, you need to check patient name, date of birth, and the address of the patient. And also, as I said, you need to ask the reason of their admission and then the reason of your encounter with them. So this is our pre-procedure and introduction. At the end of the introduction, you can tell them why you are there, why you're there, and then if they want you to do anything before you start the procedure, if they are in any kind of pain, if they need a toilet or something else. So ask the patient if they need anything from you before you start the procedure. Midstream urine, there is a teaching that you need to provide to the patient, and it's very important. And also you need to remember whether your patient is male or female, because there is a different kind of different pre-procedure things that you need to do. Like when they're going to take the sample from the toilet, they need to clean it differently, right? To take the sample, to take the midstream urine, we don't want any infected urine sample. So you need to explain to the patient how they're gonna take the midstream urine, and how they're gonna clean themselves afterwards and before taking the sample. Here on this stage, in the preparation of the patient, we need to explain the procedure to the patient. And if it's a female patient, you need to explain it to them that they need to clean their private part with normal saline or non-detergent soap. Same cleaning solution can be used for the male patient. They can use normal saline or as well, or non-detergent soap to clean themselves for general cleansing and to prevent sample contamination. Yeah, so if it's a female patient, you need to tell them that you need to go to the toilet, wash your hands with soap and water thoroughly, and then you're gonna part your labia, clean the urethral meatus first from front to back. Then one part of the labia and the other part of the labia is same procedure from front to the back. Yeah, so they're gonna clean from one part of the labia from top to the bottom, and same goes for the other one. And then tell them that they need to clean, they need to tap dry with a separate paper towel. And also with the pad drying, also with a separate paper towel. It's always from front to back or top to bottom, whatever they want to you want to explain to the patient. And then also tell them before taking the sample, after taking the sample, wash your hands thoroughly. So they have cleaned their area like perfectly, everything is fine, that you have explained them, that you have explained already that how they're gonna clean it. Now it's the time to take the sample. So how they're gonna do it? So we are just in the stage where we are explaining everything. So if patient can go to the toilet, they can go to the toilet, but after all your explanation that you are giving them, right, you have told them that they need to clean. Now you're gonna tell them how to take the sample. So if they're using bedpan, they can do same on the bedpan. If they're using toilet, you can tell them that they can start voiding, they can start passing the urine, and then they can void maybe 15 to 30 mils, and then in the midstream, they at this point they need to put the wide mouth container. You're gonna give them the wide mouth container. At this point they can put the container they can put the container in the stream of the urine without interrupting the flow of the urine. Yeah, they can continue voiding, but they need to put the container in between. After passing 15 to 30 mils of urine, they need to put the container and get the sample, maybe 10-15 mils or half mid, or you can tell them like just full the container or 3/4 of the container, whatever. Yeah, so mostly it's 10 mils, so they can just take a half of the container, and then after passing that urine, they can void the remaining urine into the toilet, and then they can wash their hands and come back, and you can get the sample from them. Yeah, so this was the procedure for the female patient, how they're gonna do it, and it's the same method for the male patient, but only the cleaning procedure is different because they don't have labia majora or minora or anything, right? So for them, they just need to hold back the foreskin and then wash it thoroughly with soap and water or non-detergent soap, and then they can get the sample after cleaning their penis. Yeah, and they can get the sample and wash their hands. It's the same procedure except holding back the foreskin. Yeah, so now they have taken the sample. You can tell them that before you come back with your sample, you need to wash your hands, then you bring the sample back, and now they have given you the sample. Now is the actual procedure that we are going to do. Taken the sample from the patient, you need to wash your hands thoroughly. If you don't have a sink there or in the exam setting, you can clean with the alcohol gel. After cleaning your hands, you need to put your apron and gloves and check the reagent strip of their check the expiry date of the reagent strip. Usually it should be stored in the dark and cool place, and then you're gonna take one strip. You need your watch, you need to use your fob watch. Put your fob watch on the table, and then check the expiry date, as I said in the check the expiry date of the reagent strip. After taking one reagent strip, you can verbalize that I will close it tightly right away, making sure that no air can pass. Yeah, so just verbalize that I will close the reagent strip cap. I will close the cap of the reagent strip right away tightly, and then I will put it in dark dry place, and for the storage and according to the manufacturer guidelines, if you want to say so. So we have taken a strip. We are wearing gloves and apron. We have our fob watch there, and then you can put 1 or 2 paper towel just to put the strip on. So what you're going to do, you're going to open the urine specimen container, and then take the reagent strip, dip it into the urine for 1 minute, only 1 minute, 1 second, sorry, only 1 second. You're gonna dip the urine strip in reagent strip into the urine only for 1 second and take it out right away. Then it says run edges of the strip alongside the container just to avoid extra urine on the spreading all over. So just run the edges of the container alongside the container. Run edges of the strip alongside the container to remove excess urine. Now here one thing we need to remember, after dipping the urine into the urine, you need to how would I say, just give me one moment. So let's say this is my urine container, this is my strip, so you need to run it to the edges like this to remove excess urine. After removing the excess urine, you need to hold the strip at a particular angle, not like this, not ups and down. It should be horizontal like this. Yeah, so after dipping it, you need to hold it like this and then put it on the paper towel. Why we are not holding it ups and down? Because with the urine, the reagent of the strips, if you see, there are small squares on the strip, right? So if we hold it ups and down, the reagents can mix and then it will not give you appropriate results. That's why we hold it at horizontal position, not at vertical. So now we have kept it on the tissue paper, on the paper towel, and we'll wait and document. We kept it on the table on the paper towel, so we can document at the correct time, like such as glucose is read at 30 seconds. So everything is recorded at different timings. So if it says 30 seconds, you need to wait for 30 seconds before you go to the next point and before you record that reading. If this glucose says like after dipping the strip 30 seconds, you need to wait, then you see the result. So now it's 30 seconds and the result is this, it's positive or negative. So then you're gonna read it. If it says for example, if it says nitrate at 1 minute or 1 minute or 45 seconds, you need to wait 45 seconds. Trust me guys, trust me, examiner would be watching you. Yeah, she or he would be watching you. They calculate that time and then they start from the right time that you start. Okay, so don't think that they are not taking notice of it. And then there are cameras as well, so please do it according to the time. If it says 50 seconds, wait for 50 seconds before you read that particular point. All right, and then if it says blood, it should be read at 30 seconds or 55 seconds, read it at 55 seconds. This is very important thing. Yeah, and after getting all the reading, make sure you document it. And then if you can't remember, just like keep it in your mind. You will be having a paper where it says like glucose plus or ketones plus or minus, whatever. So just make a small dot. If you have pen in your hand, just document it right away. But you're wearing gloves, so if you're holding your pen, you need to take it off. It will waste loads of time. So I think it would be good for you to keep it in your mind that glucose is 4 plus or blood is positive or ketones is positive. Yeah, keep it in your mind. So now because of the COVID, I think they will not give you a real urine sample. What they do, sometimes they put sugar in it or something else just to get the reading, just to see what are the results. And then most of the time they would know the results. They do the dipstick before you do, so they would be aware what are the results going to be. Okay, and after that you can remove your gloves, perform hand hygiene, and explain the results to the patient. Yeah, and provide health education if it's needed. If they were leukocytes, you can tell to the patient that there is some kind of there is infection in your urine. I'm gonna explain it. I'm gonna tell the results to the doctor, or if you need to send the sample to the lab, and we will do accordingly. Explain to the patient if there is sugar in their urine, if there is leukocytes or anything else. Just explain, health educate the patient if you can, and then tell to the patient that what will then be the next procedure. And now tell them that I've also documented everything for the doctors or for the other member of the staff to see. So now you have you can remove your gloves. Yeah, perform hand hygiene, and then you're gonna reapply the gloves and discard the urine sample into the sluice room or wherever. Sluice room, yeah, into the sluice room, because just to prevent environmental contamination, you're gonna discard urine sample into the sluice room. Also, you're gonna remove your gloves, you're gonna discard the reagent strip, you're gonna remove the apron, and it should be discarded into the orange waste bin. So this was our urine dipstick, midstream urine we call it. So the important thing is the health education of the patient in the beginning and at the end, and what are you going to do afterwards when you get the results. And then the proper disposal hand hygiene is important as well. At the end of the station, you can ask the patient comfort and safety before you leave, and then ask them if they need you to do anything. That's it guys, that was all the video about midstream urine. We have discussed all the important parts. If the examiner says you don't need to do pre-procedure and introduction, start with the actual procedure. But if they say start with the preparation of the equipment, then you need to prepare the equipment. If they say start with the actual procedure, then you're gonna start with the actual procedure. And then before you leave, check your patient is comfortable, it's safe, and they don't need anything from you. Yeah, say thank you to the patient and to the assessor before you leave the station. Thank you so much for watching. Have a good day, guys. I'll see you in the next video. Keep watching. If you like the video, please give it a big thumbs up, share with your friends, and subscribe to my channel.